Hey everyone, and welcome to this explainer. Today we're diving straight into the hidden hand hygiene traps of the real chaotic NICU workflow. Look, we all know the basics, right? Wash your hands when you walk in, wash them when you walk out. But today we're going to look at the data to see where the real risk actually lies. Because the contamination that leads to healthcare-associated infections, it usually doesn't happen from some dramatic, huge mistake. It happens right in the middle of our normal everyday workflow. Let's get started.
Okay, picture this realistic scenario. You're in the zone performing clustered care. You open the incubator, you gently reposition the infant, a monitor beeps, so you quickly reach up to silence the alarm, you pull some supplies a bit closer to you, and then you check the feeding tube. The whole shebang happens in less than a minute. It is highly, highly efficient. But where exactly did our nurse miss a crucial hand hygiene moment?
Let's watch how this builds. Every single transition, from touching an alarm to touching a tube, is a potential invisible contamination point. The danger here is what we call task stacking. See, the alarm, the bed space, the supplies, those are environmental surfaces. When you touch them and then immediately pivot to an aseptic task, like checking a feeding tube without resetting your hands, you've literally just transferred organisms right to the patient.
All right, moving into section 1, missed moments in workflow beyond room entry and exit.
Now, look at this data from a recent quality improvement project. It is fascinating because it highlights this huge human bias we all have. Compliance is incredibly high. We're talking 80% after touching body fluids, mostly because, well, we naturally want to protect ourselves. But that compliance drops drastically, down to just 50.7% right before touching the patient. We are super diligent when a task feels dirty, but we completely drop the ball when transitioning into a clean task. So, the absolutely crucial point we've got to internalize on the floor is this. Same patient does not mean same task. I'll say that again. Same patient does not mean same task. Hand hygiene isn't just triggered by swapping patients or walking through a door. It's triggered by changing tasks. If you move from a dirty or environmental task to a clean or aseptic one on the exact same infant, your hands need a reset. No exceptions. Which brings us to section 2, the false safety of gloves, a dangerous cognitive shortcut. Listen to this anonymous quote from a NICU nurse. It perfectly captures a really dangerous misconception about non-sterile gloves. They said, "I see that many of my coworkers wear gloves instead of washing their hands to save time and get the same level of protection. It's such an easy mental shortcut, right? We slap the gloves on, our hands feel protected, so we just assume the baby is protected too." But research actually shows that the misuse of non-sterile gloves is one of the most common causes of lower hand hygiene compliance. The harsh reality is that the second your gloves touch a bed space, a monitor, a piece of linen, or heaven forbid, your phone, they're contaminated. They no longer protect the infant. Gloves are task-specific. They are not a free pass to skip hand hygiene. If you're wearing gloves and you touch the ventilator panel, those gloves are now literally a vehicle for transmission. You've got to take them off, clean your hands, and start totally fresh for the next task. Let's move to section 3. Contamination drift and care, losing track of cleanliness. As we move through the NICU, every unconsidered step, every quick little adjustment acts as a vehicle for transferring organisms. I want you to imagine your hands leaving glowing, invisible footprints all over the pod. From the computer keyboard to the incubator porthole, pathogens are easily hitching a ride on those gloves or unwashed hands. And you know, we always start an episode of clustered care with completely clean intentions. You wash up, you're ready to rock. But then the reality of sequence drift sets in. You touch an environmental surface to pull a wipe, you adjust a monitor lead, maybe you quickly silence a pump. This sequence drift carries germs right back to the baby, simply because you've slowly drifted from a clean state to a contaminated one without even realizing it. Get this. Baseline data from major level 3 NICU study shows that hand hygiene compliance after touching patient surroundings is a staggering low of 17.74%. Think about that for a second. That means more than 80% of the time healthcare workers touch a monitor, a pump, or the outside of an incubator and then go straight back to patient care without sanitizing. It's a massive, massive blind spot for us. Because of this blind spot, we really must break the habit of thinking a quick reach into the incubator is somehow harmless. You know the feeling. Oh, I'm just fixing the pacifier real quick, or I'm just tucking the blanket. No way. A quick touch carries the exact same risk as a long procedure. If your hands haven't been cleaned right before that entry, you are exposing that immunocompromised neonate to literally everything you touched previously.
So, to combat this drift, we have to actively identify reset points during our clustered care. We've got to break that chain of transmission. Now, cluster care is fantastic for the baby's development, absolutely, but you must reset between the steps. Memorize these reset points, okay, before touching the infant, before any aseptic line steps, after diapering or handling secretions, and crucially, after touching bed space monitors, keyboards, or pumps.
Up next is Section 4, Scripts for Safer Hands, Rewiring Workflow Habits. So units that actually successfully reduced neonatal sepsis implemented the SAFH, or SAF protocol. This anchors the workflow heavily on the aseptic non-touch technique and the WHO's 5 moments of hand hygiene. One tertiary NICU actually reduced their healthcare-associated infections by 50%, half, just by rigorously standardizing this. It's all about creating a forced mental pause before every critical touch. One of the best ways to enforce this pause is to give yourself a simple internal script during care transitions to break your autopilot. Try just saying to yourself, new task, new hands. It takes literally less than a second to think it, but it immediately prompts you to hit that sanitizer dispenser before you transition from, say, a dirty diaper to an IV line. Or let's say you reach up to silence a monitor. Immediately remind yourself, touch the bed space, reset before the baby. These are just little cognitive speed bumps. They pull us out of our routine and force us to recognize the invisible risk of sequence drift before it's too late. Finally, Section 5, the reflection check. Applying this to your pod. Look, we can talk about data all day long, but it only matters if it changes what we actually do at the bedside. I want you to think deeply about your specific pod right now. What environmental surface do you grab most often right before you should stop and wash? Is it your mobile phone? Is it the IV pump? Maybe the charting keyboard? Identify your personal traps so you can anticipate it next time. And to wrap things up, ask yourself, where in your most chaotic, clustered care sequence are you unknowingly drifting from clean to contaminated? Remember our golden rule, same patient does not mean same task. As you head into your next shift, I want you to ponder this. Are your most efficient workflow habits actually putting your most vulnerable patients at risk? Keep those reset points top of mind, and let's keep these babies safe. Thanks for joining me on this explainer.